Hello everyone, I am Dr. Devender Singh, Senior Vascular Surgeon from Yashoda Hospital, Somajigoda. 6th August is celebrated as National Vascular Day. Greetings from Yashoda Hospital. On this 6th August 1994, few of the senior surgeons, with the vision and mission, they sat together and they have constituted this Vascular Society of India. The reason? Because of the disease burden. So much of population suffering from vascular diseases, more than heart issues, more than brain issues, more than cancer. And that is how they started this Vascular Society of India. Now, there has been a lot of progress in the vascular society, vascular diseases, awareness, management and treatment. In spite of that also, still what we are treating is just a tip of iceberg. What we are seeing is just a tip of iceberg. What we are not treating is the major chunk of the iceberg. Sudden death due to pulmonary embolism, amputations due to peripheral vascular disease, a major stroke leading to disability because of blockage in the blood vessels, and sudden death because of pulmonary embolism, because of the clot in the pulmonary artery, amputations because of peripheral vascular disease, major stroke leading to disability because of blockage in the carotid arteries, still high on the rise. We can still avoid these things. We can only avoid by awareness and early detection. When it comes to awareness and early detection, we have to know what are the vascular risk factors. Once we know the vascular risk factors, probably we can avoid all these complications, and 90% of the treatment can be managed with lifestyle modification and simple medications, doesn't require any major surgical interventions or endovascular procedures. In the vascular risk factors, we have patients suffering from diabetes mellitus, hypertension, patients having heart disease, brain disease, kidney disease, patient who smokes, patients who take alcohol, patient who's been taking tobacco in any form, and patients who are obese. These are the risk factors, vascular risk factors. And we have to identify these factors and put them into the screening program, because once we put these patients into the screening programs, probably we can avoid major complications. Ladies and gentlemen, we have faced pandemic COVID. We are still in a challenging phase. We have seen a lot of death and disabilities because of COVID. The reason? Because of vascular inflammation, the inflammation of the blood vessels, and because of clot formation inside the blood vessels. We are going to face these challenges in coming years also. What is required in these pandemics and these challenging areas is that we have to identify vascular risk factors patients, because these are the patients who suffers major morbidities. These are the patient who succumbs to these kind of illnesses. These are the patient who gets into disability. The stress for me today on this particular day of 6th August, the National Vascular Day, is that we should focus on more and more awareness, and we should focus on lifestyle modifications. Lifestyle modifications means we should control blood pressure, we should control sugar levels, we should ask patients to be in follow-up if suppose they have any heart problem, they have any issues with the kidneys, they have any issues with the brain. They should always remain in touch with their physicians. Most importantly is the exercise. Blood vessels, for them, the best tonic or the best medication is an exercise. So I appeal to all of you on this particular day that each one of us should have to go for some kind of exercise therapies, maybe 20 minutes in the morning, 20 minutes in the evening. That is how we can avoid any vascular complications. Please be safe and take care. Thank you very much.